start with your patient side lying, and the testing limb is going to be on top. So their bottom leg will be bent, so to provide them support so they don't tip over. And then you'd bring them through the passive range of motion. So that would be a 3. Then you would cue your patient to lift your leg up, keeping your leg straight. If they can withstand resistance at the knee, that would be a 4. If they can withstand resistance at the ankle, that would be a 5. And then for grades 2, 1, and 0, you'd have them lying supine. Still standing at the testing side, you would palpate laterally at the greater trochanter area, and then you would hold onto underneath their ankle just to reduce friction, and then ask them to move through the same ranges of motion, making sure that you're not moving them. So 2 would just be being able to move through the partial range of motion. 1 would be a contraction at the lateral hip, and 0 would be nothing. Okay, so for hip abduction, targeting the TFL, you're going to start the patient in the same position as they were for the other hip abductor test. So side lying, testing limb on top, bottom leg bent for support. But this time you're going to flex the top leg to about 45 degrees. Same thing, you're moving through the passive range of motion. And then ask them to, keeping your leg straight, you're going to raise your leg up to the ceiling, and then max resistance would be still offered at the knee, moderate resistance, and then would be 4. For the tests 2, 1, and 0, you'd have the patient in long sitting, so they're going to sit up this way to keep your legs on the table. Yep. And then you can reach, they can reach behind them for trunk support. And you're going to palpate at the lateral hip in the greater trochanter area, and then again you're going to offer reduce friction at the ankle, and then have them move their foot outwards, keep your legs straight. Good. So partial range would be 2, being able to palpate the muscle would be 1, and 0 would be nothing. This is a test for hip adduction. So the patient's going to start side lying, the therapist is going to be behind the patient. So your legs are going to be completely straight. Try to straighten out your body. And then the testing limb this time is going to be... Why?
Did you hit my butt?
With my knee?
Yeah, baby. Crack.
Coo. You hit my coo.
My coo. What's a coo? Okay, let's just redo.
This test is for hip adduction. So the patient's going to start side lying away from the therapist. This time the testing limb is going to be on the bottom, so both legs are going to be straight, and the top leg is going to be held by the therapist in some abduction by going through the full range of motion, which would just be bringing your bottom leg up to your other leg. That would be a 3. You'd offer resistance at the knee, so go ahead and bring it up again. Moderate would be 4, max would be 5. For grades 2, 1, and 0, you would lie supine. And this time, the therapist would go on the same side as the testing leg, again holding at the ankle to reduce friction, and then placing the hip in some abduction. After that, you're going to palpate at the proximal thigh and ask them to bring their leg in towards the other one. So just making sure that gravity, or that you're not helping them. External rotation, so you're going to start your patient in short sitting. The therapist is going to be sitting or kneeling at the same side as the testing limb. So we'll test the right one. You're going to start by asking them to move through the range of motion. Nope. So you're going to bring your heel in like to your other leg. Yep. So rolling their femur outwards. Good. So you relax. So after that, to offer resistance, you would have them, you would offer resistance at the medial ankle, and then just stability at the knee, asking them to do that same movement and not let me pull your leg out. So moderate resistance would be a 4, maximal would be a 5. For grades 2, 1, and 0, you would have them lying down, supine, standing at the same side of the testing leg. you'd be the same thing, that you would just ask them to turn their leg or roll their leg inwards, looking for any kind of partial movement. There's not too much you can do for palpation, but you can still offer at the upper thigh, and then no movement would be a 0. For an alternate test, for an alternate grade 2 test, you'd have the patient in short sitting again. This time you would place them in maximal internal rotation and then just ask them to return to a neutral position. So this is a test for hip internal rotation. So for the first test, 3, 4, and 5, the patient's going to be in short sitting. Therapist is going to be sitting or kneeling in front of them. This time resistance is going to be offered at the lateral ankle and then just stabilizing the knee. So you're first going to go through internal rotation, moving your knee outwards or your ankle outwards. Good. And then resistance is applied. So you're going to offer resistance pushing inwards. Moderate would be a 4, maximal would be a 5. For an alternate test for grade 2, you would have them in this position as well, this time starting them in a maximal or a maximal external rotation and then asking them to move back into a neutral position. For the normal tests for grades 2, 1, and 0, you'd have them lying supine and then just asking them to roll their leg outwards. Looking for any kind of range of motion would be a grade 2. 1 would be hard to palpate, but you would palpate at the upper thigh, and 0 would be